Hey everyone, welcome back to my channel. I'm Sheila G, the PAC, and today we're going to be talking about another form of hair loss known as androgenetic alopecia. Before jumping in, of course, don't forget to like, comment, and subscribe to my channel for all things dermatology. Let's get started. In my last video, I talked about alopecia areata, which is a common form of non-scarring alopecia, which involves the sudden loss of hair in these smooth, round patches. Now, androgenetic alopecia is another form of non-scarring alopecia, but this is more generalized progressive hair thinning due to the influence of genetics and hormones. Now, androgenetic alopecia tends to be a little bit more common in men, but it can definitely happen in females. We may also refer to the condition as either male pattern hair loss or female pattern hair loss. To better understand androgenetic alopecia, let's go over how androgen hormones affect the hair follicle. Now, testosterone is an androgen hormone that's produced by the gonads and in small amounts by the adrenal glands. Testosterone is converted to dihydrotestosterone by an enzyme known as 5-alpha reductase, and that's important when we talk about the treatment of this condition. So dihydrotestosterone is the more potent form of testosterone, and it has a very high affinity to binding to certain receptors known as androgen receptors that are directly on the hair follicle itself. And so when that hormone acts on that receptor, it will actually shrink the hair follicle, which leads to that progressive thinning and hair loss. The increased levels of dihydrotestosterone and that high sensitivity to the hormone by the receptors is actually more genetically determined, hence the name androgenetic alopecia. And we don't see this form of hair loss present until after puberty, usually far after puberty. So this androgen receptor activation by dihydrotestosterone also shortens the anagen phase of the hair cycle, which is the active growth phase. So the hairs become very thin and also very short, where some hairs might not even penetrate through the skin at all. And so these terminal hairs, which are the thick hairs that are present on the scalp, actually transition into what's called vellus hairs, which is essentially peach fuzz. Remember, this form of hair loss takes place over a year's time, so it's a very progressive condition, but it's very important to catch it early so we can treat it early. Now that we know what causes this type of hair loss, let's go over what it looks like and how it differs between men and women. Now, in men, early signs of thinning start to show up at the anterior hairline, and then we see bitemporal recession, so some thinning right at the sides of the hairline. And then we may also see some thinning and hair loss more commonly at the vertex, or otherwise known as the crown, so right up here. In women, the hair loss and hair thinning tends to be a little bit more diffuse, but we can also see what's called a widening part and also some thinning around the vertex or the crown. When we examine the hair, we might use a magnifying tool known as a dermatoscope, and we start to see what's called miniaturization of the hair follicle, where we're noticing the shrinkage of that hair follicle. We also do this to rule out any other forms of hair loss or any other scalp conditions. Now let's talk about the treatment for androgenetic alopecia. It's important to understand that there is no cure for this type of hair loss, but we can try to slow down the progression and hopefully regain some hair or at least some hair thickness. I'll be honest, this is a very, very difficult condition to treat, but we do have some FDA-approved treatments and some other things that we can try. So the two FDA-approved treatments for androgenetic alopecia include topical minoxidil, otherwise known as Rogaine, which is a common brand, and that's available as either a foam or a solution. We also have oral finasteride. So minoxidil in its oral form was originally a blood pressure medication, but we found that it can actually increase hair growth, so it was turned into a topical form. Topical minoxidil essentially dilates the blood vessels so it can nourish the hair follicle, and it can also increase the amount of hairs that are in the anagen growth phase. The goal of any of these treatments is to actually just slow down the progression of the hair loss, but we always hope to see new hair growth. For the most optimal results, topical minoxidil must be applied daily, so it's a commitment. And for any noticeable improvement, it takes at least 6 months to see any change. So be consistent and stay hopeful. I will say too, this is very important, that what can happen at the early stages of using topical minoxidil, we can go through a little shedding phase. So you can see a little bit more hair fallout, which a lot of patients understandably are terrified of that and they stop using the medication. But if that happens, that is a temporary thing. Keep using it, be consistent, and hopefully you see some really good results. If you don't see more hair growth or more hair thickness, hopefully we can reduce the amount of hairs that are shed and slow the progression of the condition. Now, oral minoxidil may be used in some patients at low doses. Again, it was originally a blood pressure medication, but we know it can help with hair loss. However, it can have some side effects. You can see issues with blood pressure, so low blood pressure, a high heart rate, dizziness, headaches, and even EKG changes in some patients. So anybody that has a cardiac history or any issues with blood pressure, it's probably not something you want to be on. Another common issue with oral minoxidil is what's called hypertrichosis, or excessive hair growth throughout the body. So yeah, it can help treat your hair loss, but you might get too much hair in other places that you don't want. And then we have oral finasteride. So remember that enzyme 5-alpha reductase that converts testosterone into dihydrotestosterone? Well, finasteride is part of a class of medications that actually inhibit that enzyme. And so because of that, we're going to have decreased levels of dihydrotestosterone. And so less of that hormone is going to be acting on the hair follicle. And so because of that, we're going to slow down the progression of the condition and hopefully even see some new hair growth. Now, because we're kind of altering that hormone a little bit and decreasing the amount of dihydrotestosterone, we might see some side effects in men, such as gynecomastia, which is actually breast tissue development, or even more sexual side effects, such as low libido or erectile dysfunction. However, those side effects are pretty uncommon and the incidence is pretty low. 5-alpha reductase inhibitors like finasteride are not routinely recommended in women of childbearing potential because of their risk of birth defects. Also, there is another type of 5-alpha reductase inhibitor known as dutasteride, which can be used off-label to treat hair loss. Now, for some women experiencing androgenetic alopecia, there is oral spironolactone. Now, oral spironolactone, again, was another blood pressure medication, but it has anti-androgen effects, so it can be helpful in some cases in those who have androgenetic alopecia. Now, it should be avoided in pregnant women or women that are trying to get pregnant, and some side effects include menstrual irregularities, lightheadedness, dizziness, and we can even see increased potassium levels in some cases. So these things should be monitored. However, not super common in young, otherwise healthy patients. Another popular treatment for androgenetic alopecia is what's called platelet-rich plasma, and that is a procedure that can be performed in some dermatology offices. And that's essentially where a portion of your blood is taken and then it's spun down to get just the plasma portion on its own. And the plasma is very rich in growth factors, and this plasma portion is actually directly injected into the areas of hair thinning and hair loss. Treatments do have to be repeated every 4 to 6 months to get the most optimal outcomes, and I will say about 70% of patients see a good improvement within 6 to 12 months of treatments, but you have to keep up with it. There's also red light therapy, vitamin supplementation, and of course, hair transplantation is always an option. The earlier you treat, the better the outcome. However, just know that the more advanced the staging is of the condition, the harder it can be to see any difference. So, combination therapy using multiple treatments at once tends to be a little bit more effective. So for example, a patient that's taking spironolactone may also use topical minoxidil and even maybe some vitamin supplementation, depending on the patient and what they can and cannot use and what their needs are. So there you have it, all about androgenetic alopecia. Thank you guys so much for watching, and if you have any questions, please feel free to comment down below. Don't forget to like and subscribe to my channel for all things dermatology. I'll see you next time.